ranking members and ranking member Senator Sanders and other members of this distinguished committee. Cheryl and I were heartbroken last night to learn of the tragic accident that took so many of our fellow Americans, including our service members. We are in an apartment where we were able to see the rescue operations from our window. Senator Marshall, please know that I will continue. There you are. I'll continue to pray for you as I texted you last night. For those who were lost, who called your state home, as well as Senators Kaine and also Brooks. We appreciate the first responders and local officials who are working so hard. May God continue to be with us all who are impacted and those who continue to help with the recovery. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I'm grateful to have my family here once more with me. I want to introduce my wife, Cheryl, my daughter, Kik, my son, Bobby, my daughter-in-law, Amaryllis, and my nephew, Jackson Hines. I want to thank them as well as the many members of my large extended family for the love they have so generously shared. I want to particularly thank you, Mr. Chairman, for the time you've spent with me and the times we've talked in person and by phone. I greatly admire your passion for public health and your commitment to science. And this committee is blessed to have a medical doctor at the helm and two other medical doctors, Dr. Marshall and Dr. Rand, on the committee. I explained yesterday to the Finance Committee that my journey into the issue of health began with my career as an environmental lawyer, working with hunters and fishermen and mothers in the communities and small towns along the Hudson River. I learned that human health and environmental health are intertwined and inseparable. The same chemicals that kill fish also sicken human beings. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than in 1960. Cancer among young people is rising by 1 or 2% per year. Autoimmune diseases, neurodevelopmental disorders, asthma, Alzheimer's, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise. The United States has worse health than any other developed nation. Yet we spend more on health care, sometimes double, sometimes triple, as other comparable nations. Last year, we spent $4.8 trillion, not counting the indirect costs from missed work. That's almost a fifth of GDP. It is tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for their health care and yet have a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to resurrect America's global strength and our leadership and to restore the American dream. And he understands that we can't be a strong nation unless we're first a healthy people. A healthy person has 1,000 dreams. A sick person has only one. Today, over half our countrymen and women are chronically ill and have only one dream. When I met with President Trump last summer, I discovered that he has more than just a concern for this tragic situation, but genuine care. President Trump has committed to restoring the American dream, and 77 million Americans delivered a mandate to do just that, due in part to his embrace and elevation of the Make America Healthy Again movement. That movement, led largely by Maha moms from every state, many of whom have traveled to be here yesterday and today, Senators, this is one of the most powerful and transcendent movements I've ever seen. The nation is ready for change and recognizes that this is a unique inflection moment. I've promised President Trump that if confirmed, I will do everything in my power to put the health of America back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, both Democrats and Republicans. I came away from our conversations hopeful that we can put aside our divisions for the sake of a healthy America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20% of GDP, there are no good options, only bad ones. Shifting the burden around between government and industry and corporations is like changing deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change course and ask the fundamental question, why are healthcare costs so high in the first place? The obvious answer to that question is chronic disease. The CDC says over 90% of healthcare spending goes toward managing chronic disease, which hits lower-income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all Americans healthy again. There is no single culprit for chronic disease. Much as I've criticized certain industries and agencies, President Trump and I know that most of the scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure this committee is clear about a few things. News reports and many in the hearing yesterday have claimed that I'm anti-vaccine and anti-industry. Well, I'm neither. I'm pro-safety. I'm pro-good science. I worked for 40 years to raise awareness about mercury and other toxics in fish, and nobody called me anti-fish. All of my kids are vaccinated. I believe vaccines have saved millions of lives and play a critical role in healthcare. Nor am I the enemy of food producers. American farms are the bedrock of our culture and our national security. I was a 4-H kid, and I spent my summers on ranches. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed if we do not have the partnership of America's farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions, and I'm not going to apologize for that. We have massive health problems in our country that we must face honestly. And the first thing I've done every morning for the past 20 years is to pray to God that he would put me in a position where I can end the chronic disease epidemic and protect our children. That's why I'm so grateful to President Trump for the opportunity to sit here before you today and seek your support and your partnership in this endeavor. I'll conclude with a promise to you, Mr. Chairman, the members of this committee, to the President, and most of all to the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives to our food supply. We'll remove the financial conflicts of interest from the agencies. We'll create an honest, unbiased, science-driven HHS accountable to the President, to the Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health.